Good morning, ladies and gentlemen. My name is Dimitrios Pefanis. I'm the General Manager of insider.gr, and it's my honor and privilege to welcome you to today's first panel, aptly named COVID-19, When Will It End? I guess it couldn't have come at a more crucial time. We are in the midst of a lockdown in the Hellenic area. We're about to have a national-wide lockdown in a few hours, and everyone's mind is what's going to happen next. What will happen both in the medical front but also in the fiscal front, because those two fronts are intertwined, and it's everybody's concern what's in view for 2021 or later. What will happen with our daily lives? What will happen with our jobs? What will happen with the country's fiscal growth? So we have a great number of panelists today with us. The Honorable Deputy Minister of Health and of the Hellenic Republic, Mr. Vasilis Kontozamanis, will be with us shortly. He's currently, as I'm told, in a meeting with the Prime Minister. These are very crucial times, but he will make it towards the end of the panel. We have Mr. Spyros, Lieutenant Colonel Spyros Georgiou, who is the spokesperson for the Ministry for Civil Protection and Crisis Management of the Hellenic Republic. And we have Mr. Álvaro Santos Pereira, the Director of the Country Studies Branch at the Economics Department for OECD France. So without further ado, I'd like to give the floor to Mr. Álvaro Santos Pereira, who has a very interesting presentation for us regarding the fiscal impact, the outlook for the pandemic, and what's going to happen both on a global level, but also in regards to Greece. Mr. Álvaro Pereira, the floor is yours, and we're looking forward to hearing your insights.
Well, good morning, everyone. Thank you very much for the invitation. I'll concentrate my analysis not only on what could happen to the world economy in Greece, but mostly Greece afterwards. But we obviously, in terms of the Q&A, we can discuss how the OECD sees the next few months as well. But I'm going to share my presentation so that you're able to see what we have in mind. I think that the most important thing for us, or to think about how the crisis is playing out, is really the word uncertainty. We don't know exactly, obviously, how the virus will play out and what will happen in the next few months. We have some hints, we have some clues, but uncertainty is pervasive, both in terms of health, but also in terms of the economics. Just to give you an idea, this is a graph that shows you how do we see the economy, how we saw the economy in September. And what could play out. This is for the world economy, not for Greece. But this graph, basically, the blue line shows what we expected the world economy would evolve around 1 year ago. And the red line is how the economy has been evolving and how do we expect it will evolve in the near future. So you can see big dip, big recession, the unprecedented recession around the world, with the fall of the GDP of the world economy around 4.5%, 5% this year. And then afterwards, if the virus would subside, then it would have a very...
Pereira, I'm sorry to interrupt, but we cannot see your presentation. Would it be possible for you to enter the presentation mode, actually to share your screen, so as to see your presentation?
I think, okay, so...
but you're referring to graphs which we cannot see, and that's pretty important.
I thought that the presentation was... Okay, I'll try to share my screen again. Let me know if the presentation you don't see the screen. Okay, can you see it now?
Nope.
Not yet. Okay. Okay. Let's see if I can. I need to go to presentation mode. I apologize for. Let me see. Anyway, I'll try to talk while we do this sort of thing. Otherwise, I'll talk without the slides if needed be. Let me try just once again. I'm used to use another platform, and so that's why. Okay, let's see if I can do this one thing. You're still not seeing, right?
That's right. I'm afraid not.
Okay, listen. I think I'll talk without showing the slides, so it's fine. Anyway, We expected a big dip this year and then a recovery. What matters is for us is that for Greece was starting to recover after the big crisis that we had. We are starting to recover. We had unprecedented crisis in Greece.
Okay.
For the first time, we're starting to. You can see now? Not yet.
It's for a blink second. It started showing, and then you have to do the full presentation. You have to you have to put on full presentation in order for that to appear on screen. It appeared for a second, and then it went off. But we're getting there.
Well, otherwise I can send the presentation to you, and then you can send it, put it there if needed to be. But okay. Anyway,
okay. Yeah, it's working right now. So
it's working now.
Yeah, we can see it. Yeah.
You can see it now.
Yeah.
Okay. So can you see the slide?
Yeah. We can see it now.
Okay, great. Okay, so you can see that the blue line is basically how we saw the economy evolving, just a 3% growth last year. And then suddenly we had a pandemic from February this year onwards, a big dip. So unprecedented shock in incomes, unprecedented shock in demand. We had, of all the countries that we follow, at this stage, more than 50 countries that follow directly. Only China is showing a little bit of positive growth, but everybody else is strongly in negative territory. And so we were expecting in September that the economy could recover very slowly, as you see the red line, with the loss of the world economy already of $7 trillion this year. However, we also estimated two scenarios. One, which you see the yellow dotted line, is the scenario in which the economy, because there will be potentially a second wave, would take even longer to recover, or a scenario in which we discover a vaccine or an effective treatment and then we recover faster, which is the dotted line that is green. This is the graph that I was talking. Greece was starting to recover. So this is a real GDP per capita in the OECD and Greece. You can see that there was a big dip in the real GDP per capita, or real GDP per person in the last few years. Greece was starting to finally catch up and doing fairly well, when obviously we all were faced by the pandemic. And so the scenario that we played out, and in fact last June we came out with a forecast, is this one. This is the black line is how Greece was doing in terms of real GDP. And then afterwards you had the pandemic. And then we had two scenarios at the time because of uncertainty. One is that the virus would subside, and this is the blue line, big dip, and then you recover. And the second scenario was one that we look at the previous pandemics. Pandemics are not unusual in our history, but they happen, every 100 years or so, or sometimes even less. But the last one, big one we had was 1918, and the pandemic that we had then lasted 3 years. It was 1919 to 1920. And there were several waves of the pandemic. The first wave was relatively benign. The second wave was very damaging, very lethal, and a lot of people died at the time. Yeah, mortality was much higher than right now, of course. And what we can see that what we forecasted for Greece and what we forecasted for most countries was exactly there was a big dip for the first lockdown, and then there would be a second wave like we are right now. So you can see that the economy recovers a little bit in the summer, but then it goes down again. This is the green line that you can see. So basically what we saw, what we are discussing, and what we thought at the time was that likely they would take a while, not the recovery, and there'll be ups and downs in the recovery, depending how the health situation would evolve. And this is exactly how we're seeing, not only in Greece, but other parts of the world. Obviously, you can see many European countries are going back to lockdown, including yourselves right now. And a lot of restrictions are being imposed, which means that not only the sectors that have been most affected, not only in Greece, but other countries, like tourism, restaurants, and so on, but also other sectors are being tremendously affected. And so we are continue to face an unprecedented shock to our economy. How do we see the following months and years to come? Well, we believe that the best option the next few years, or next few months, first of all, is obviously to stop the pandemic as soon as we can. But remember, this is here to stay. What our experts say is that even if you find the vaccine, it's very likely that the first part of the vaccine is not going to be so effective, or perhaps it will not deal with the virus once and for all, and so it will lead the vaccines that will come will lead mostly to less damaging parts of COVID. But if for the harder cases, probably will not work. But even if you find a very effective vaccine, likely this until the end of next year, very likely we will not be able to diffuse the vaccine and to administer the vaccine to most of the people that we need to do. So that means that we have to live with the virus for a while, and probably potentially outbreaks going forward. So what should Greece do? So just I don't want to take too much of your time. Just want to make the call in terms of how do we see things going forward. So first of all, in the short run, it's very important that the support that you've been giving to the economy and jobs, both in Greece and other parts of Europe and the world, continue, right? So when governments, for example, the UK government was thinking of starting to remove the short-time work schemes that they were giving to companies, but now they're going back to lockdown, so they extended those supports. And it's very likely that other countries will do the same thing, support companies, and especially supporting the most affected families. I think these supports for sure will have to continue until the virus subsides. And so after the pandemic is over, you need to go back to, I think, what you've been doing lately, and you need to go back to the reform momentum. And we believe that you need to deal not only in terms of fiscal, but you need to deal with the certain challenges that remain in Greece. For sure, one of the big challenges continues to be, even though you can see on the left-hand side in this graph that non-performing loans were starting to come down, both for residential loans and business loans, because now we have a sector that is so important in Greece, like tourism, that has been so affected. It's very likely that we're going to start seeing other non-performing loans in these sectors, restaurants, hotels, and so on and accommodation likely will start rising again, and this will pose an additional challenge for the non-performing loans in Greece. So on the right hand side you have non-performing loans in Greece and other countries, net of provisions to total regulatory capital. So you see that you have a big challenge still already, or we've been having it for a few years, but now it's going to get worse. The second issue is going to be obviously on fiscal. We think that right now the most important is that you concentrate your analysis, you concentrate your strength on fighting tax evasion, but also broadening the tax base and some taxes. We gave you an example here of VAT. So basically, even if you decrease the tax rate, VAT tax rate, you need to broaden the base. So that means more people pay taxes, so that you are able to collect revenue needed for what you need to spend. But we think that also there are two reforms that you've been talking for a long time in Greece, but certainly did not go through yet in a substantial way, which are the public administration reform and justice. These are reforms that you badly need, I think, but there's no fiscal implication. And these are reforms that will be crucial for you to become more efficient and more competitive. So this graph just shows you how slow is your justice compared to other countries in terms of time to resolve civil and commercial court cases. There are several ways in which countries have dealt with this situation. But you can look at a few countries, including my own, Portugal, in the last few years, in which some reforms in the justice system have been able to decrease this backlog of court cases, which is very damaging for the economy. And another issue that we think that is very important is that this graph shows you basically whether you're restrictive or less restrictive. So the graph shows if the higher the number, the more restrictive you are. I don't want to go into all these numbers. I can send you the presentation. But what matters, look at the middle, where you see regulation, simplification, and evaluation, and compare Greece with the OECD, and you can see that your regulations are still too complicated, and not evaluated enough, which means that an area in which you can have a huge improvement is exactly the part of simplifying regulation, fighting red tape. You're still too bureaucratic, and so cutting down the bureaucracy, I think, is going to be crucial in any public administration reform, so you become more competitive. And so finally, I think what matters is that you're going to have something that you did not have in the previous crisis, which is strong fiscal support from Europe, especially with the recovery and resilience facility, which is a good opportunity for you to invest in two areas that we think that is crucial. They are crucial for Greece. First of all, digital. If you look at your digital numbers, digitalization numbers, Greece is lagging behind many countries, both in terms of the private sector and the public sector. And so you can use your the monies that will come for sure from Europe to invest exactly in digital infrastructure, so that you are a fantastic, beautiful country. You want to attract more investment. You want to have more investments like you just had a few weeks ago with Microsoft. So more companies like Microsoft coming to our country in large investments. Well, you need to invest in digital infrastructure so that you become competitive compared to other countries. And related to this R&D and innovation, but also something that we think that is very, very important is skills. So I think the top priority should be using the Recovery and Resilience Facility to be a game changer for you, to help you finance the reforms that you've been thinking for a long time, like public sector administration, justice. Use that to finance those reforms at the same time that you invest in digital infrastructure and skills, investing in your people, because your the skills indicators, both in terms of the PISA scores, but also other in terms of digital skills, are still not very well. They could be a lot better. And so this is where I think you could certainly spend your money. But just a final word is basically to let you know that we believe very strongly that it's crucial that now you stop the pandemic. And so we believe that you've done very well in the first wave. Stopping now or locking down right now might help you also stop the second wave faster than other countries. But you're going to have, after the pandemic is over, as I said, you're going to have massive economic challenges and social challenges in the next few months and years. And so this is why using the available money to invest in things that will matter for the life of Greeks and the Greek people, and especially the young, the skilled, the low skilled, I think this is going to be key for you to have a faster recovery. And we can talk perhaps in the Q&A more how do we see this in other countries at a later stage. Thank you.
Thank you very much, Mr. Pereira. It was really insightful, although not very optimistic, but I definitely get your point. And we can't all but agree on the need for reform, for structural reform, and we'll definitely get back to that during the Q&A session. So I'd like to give the floor to Mr. Spyros Georgiou to move on to more, I'd say, practical day-to-day issues, as we're in the middle of a lockdown in the Hellenic area. We're about to enter a national-wide lockdown in a few hours. So what is the situation right now, Mr. Georgiou, and what have we learned from the first wave of the pandemic that we can implement now? Thank you very much.
Good morning for Athens. Good morning for the building from Sea Protection, the building Pharos, but it's mean lighthouse. First of all, I would like to introduce myself. I'm Spyros Georgiou. I'm the spokesperson of the Sea Protection Authority at national level. Also, I'm the acting director of international relations. Thank you for this invitation, and on behalf of the Deputy Minister for Civil Protection and Crisis Management, Mr. Hardalias, who unfortunately could not be with you today due to an urgent obligation, I would like to thank you once again for this opportunity. Let me start by saying that for us, working for civil protection, the pandemic has been an unprecedented challenge and huge challenge. From very beginning, by Prime Minister's decision, the General Secretariat for Civil Protection have assumed a coordinating role of all relevant authorities. And by day one of the crisis, even before the first positive case in Thessaloniki last February, we have closely cooperated with the Ministry of Health, of course, and with all competent actors in order to organize our mechanism the best possible way. We have had so far greatly succeeded in containing the pandemic during its first case. We took harsh measures very early. We followed the experts' advice and recommendations. We took difficult decisions, and we still are. We set up specific IT tools in order to ensure that we have at all times a clear and accurate overview of the situation, so as to support the political decision that needed to be taken. The civil protections has also greatly invested in setting up a model of tracking system in order to effectively track all positive cases and their high-risk contacts. This successful management of the pandemic has made Greece an example and has greatly contributed in changing its image to the world. During these times of hardship, the country's primary objective is to protect the health of its citizens and visitors, of course, as well as to try to secure continuous economic activity for every sector of the economy, including, of course, the travel and tourism industry. Following the 1st of July, when Greece officially opened up for tourism, we set up an innovative system to track the travel history and epidemiological profile of all travelers in Greece. More specifically, all passengers must fill out the passenger locator form, PLF, one day prior to their arrival to Greece, and on the basis of the specific algorithm using different variables, we are in position to determine which passenger should be tested for COVID-19 upon arrival. The PLF has proved to be so effective that, according to the European Council, there are plans for all EU countries to start using the PLF form. While we are now dealing with the second phase of the pandemic, a much more aggressive one, as our experts confirm. We are witnessing a rapid spread of COVID-19, and we have had, once again, to take the harsh decision to go to a lockdown again. It will be for 3 weeks, in hope that the spread of the pandemic will be halted. We in the civil protection continue to enforce our human resources and capability to tackle this challenge once again. We continue tracking all positive cases and high-risk contacts. We work closely together with all relevant authorities, and we keep improving our tools, our IT platforms. Let me just say that these tools mainly consist of digital dashboards comprising in real time all available data concerning the many aspects of the pandemic. For example, tracking and geographical identification of cases, as well as in the categorization of and availability of beds in hospitals and clinics. Observing the quarantine of persons who are self-isolated, including all the relevant information. So, as our discussions, there is COVID-19. When will it end? Well, recent developments show that we still have a lot to work on until we can answer these questions. One thing is for sure, if we keep observing the measures, our main weapon against COVID-19, if we go through this lockdown in the best possible way, we may see the end of this challenge a little sooner and a little closer. Thank you for your attention. I'm at your disposal for any question if you have made.
Thank you, Mr. Georgiou, and I really appreciate your comments and your, I would say, your limited optimism. But I see an optimism in your message that if we do what we need to do, then we'll be out of the woods soon enough. So before coming back to you with a lot of questions that I do have, I'd like to revert to Mr. Pereira and ask a few things regarding recovery and what his insights are. So, Mr. Pereira, you mentioned the reforms that need to be made. What I'd like to ask you is, if we do manage to actually perform the reforms, in what shape do you see the recovery in what timeline do you see an L-shaped recovery, a U-shaped, or the best possible scenario, a V-shaped scenario, a V-type recovery? And if yes, at what time frame do you see the recovery starting sometime in 2021, or are we moving from 2022 or onwards? You're muted, Mr. Pereira. Please turn on your microphone.
Yeah. Thank you. Well, obviously, it's going to depend what happens to the virus, right? So what happens, our fight against the virus is, but both in Greece and other parts of the world. Certainly, it's not going to be a U recovery. So this is what we had. We had in June. We had exactly those two scenarios. One is a kind of a V scenario, but then that meant that the virus would subside, right? So there would not be additional outbreaks. And the other one was that the outbreaks would come back. And so we know that, and this is what we call the double hit. So this is where the doubly one. But likely, if suppose that now we have this lockdown, and in Greece and other countries that have started, the country where I live in France has been locked down for at least a week and a half now. And so suppose that now we, in a few weeks' time, we open again, and which we all hope. But then let's suppose that the virus subsides again. But if it doesn't, which means that at the end of the winter, if we have another big outbreak or another outbreak, it's very likely that we'll have to do restrictions. Doesn't mean lockdowns, but it means restrictions to a few sectors at least. And if that happens, then obviously this will affect the recovery. And so we see a good possibility, unfortunately, is that it will be kind of a seesaw. We go up, we start recovering, and then suddenly have a lockdown or restrictions, and then we go down. So depending how long it will take for us to get the vaccine, or how long will it take for us to have an effective treatment. And so in the next economic outlook, which will come out on the 1st of December, for the world economy, and especially for Europe, we are going to see, our central scenario is that after the second wave, we start recovering very slowly. So we see 2021, you'll see that compared to what we forecasted just a few weeks ago, we are going to be more pessimistic, unfortunately. And so the data for 2021 is not going to be indicating a fast recovery. It's going to be much slower, and with bruises and bumps along the way. But on the other hand, there's the possibility that at the end of this year, we'll find a vaccine or an effective treatment, or early next year, and then this will lead to faster investment. So, there are several scenarios right now, and so certainly we're not seeing the recovery being on V or L or whatever. We see that it's kind of ups and downs right now, and it's likely this will stay for a little bit longer, both in Greece and the rest of Europe, and likely the rest of the world. Asia is doing better than Europe, for sure, both at containing the virus, but also economically. But if the United States and Europe doesn't do that well, that means that obviously Asia is going to do less well than it could as well. Unfortunately, we don't have any magic wand to know what will happen. But it's likely that there's going to be a bumpy road the next few months.
Well, thank you very much, and I'm really hoping for the best scenario. At this time, I'd like to inform our audience that the Honorable Mr. Kontozamanis is on the studio with us. So, without further ado, he's the man of the moment. He's one of the key people in fighting this pandemic. So, Mr. Kontozamanis, the floor is yours for an initial statement as to where we're standing right now. When a few hours before a national-wide lockdown, I'd like to have your insight on what we are facing and what your outlook is.
Good morning. Thank you very much for the invitation. Indeed, it was. We are entering a lockdown across the country. It was a hard decision, but we had to take it because I must tell you that no matter how well prepared is a health system, our resources are not unlimited. This is happening in other countries. So we had to take this decision in order to protect, first of all, the health system, and then to be able to manage the situation, because we have stiff increase in the number of hospitals.
I guess we have a communication problem with Mr. Kontozamanis. He'll most probably be back with us very shortly. In the meanwhile, I'd like to ask Mr. Georgiou what the lessons were from the first wave of the pandemic and how the Ministry for Civil Protection and Crisis Management is planning to implement these lessons. What have we learned, and what are we going to do with this knowledge from now on?
The main lesson that we learn from this pandemic is to be well prepared. That you have to be prepared for any crisis and disaster, for everything. This pandemic showed very well that the prevention and the preparation of all these things is very, very important. So for that, we have to have plans for all these issues. And in Civil Protection Authority, we enhance our existing plans for this pandemic. In the future or so, we enhance all the IT tools that would proceed now, and we enhance all the civil protection system. For that, for the last February, we have a new law for the Civil Protection Authority and a new law for the civil protection in Greece. And they change all the system of this civil protection. We create a new operational center for civil protection. We operate 4 new operational center. One it will be for pandemic issues, one of them. And of course, we create other 3 operational centers. It's for natural disasters, for critical infrastructures, and for prime ministers take the decisions.
Well, thank you very much, Mr. Georgiou. And we have the minister back online. So please.
Okay, can you hear me now?
Yes, you're in, and feel free to move on.
Thank you. Apologies, I had a trouble in my connection. So, as I told you, we had a steep increase, an exponential increase in the number of hospitalizations and a very huge demand for ICU intensive care units. I will give you an example. In the last 10 days, we had to hospitalize 95 people in intensive care units. And also regarding hospitalizations in simple beds at hospitals, we had a 63% increase in the last 10 days in the number of hospitalizations. So we had to protect, first of all, the system in order to be able in the next coming days to respond to the needs of the population. And this was the main factor that led us to the decision of a general lockdown. We are very we are very satisfied with the work that has been done so far, because our efforts so far are successful. And we have managed not only to increase the number of available beds at hospitals, but also the number of available ICU beds for COVID patients. So we strongly believe that this lockdown will give us the opportunity to contain the number of COVID cases, and we do not stop here. We still continue to reshuffle our resources, and of course we still open new ICU beds in order to be able to manage this difficult situation. Also, from the onset of this pandemic, we have almost reached the number of 25 to 30,000 tests per day for diagnosing coronavirus in the population. I would like to remind you that in March, the average number of tests per day was 850, and also we have all the necessary supplies regarding personal protection equipment, and this is very important for us, and we are building up a strategic reserve for the next coming months in order to be able to handle any global deficits in any global lack of personal equipment, personal protection equipment, and also we have secured the necessary quantities of all the pharmaceuticals that we need in order to handle the situation. We also participate together with all the member states of the EU in the common procurement of the COVID vaccine, and this is very important because it gives us we will be able to access the vaccine as soon as this vaccine it is available across the EU, and also, we still, so far, we have funded the healthcare system with extra 300 million euros in order to cover all of our needs. And we still keep on hiring people in the system. We had an initial plan for 2,000 hirings at the beginning of the pandemic, and we have exceeded the 6,800 people of staff in the system. And in addition to this, we expect almost 1,500 permanent doctors in the system by the end of this year. So we still continue to upgrade our healthcare system. It is we don't know to answer the question of in the title of the panel. We don't know when this will end, but as Mr. Pereira said, I think that as soon as the vaccine will be available, it will be a turning point in the pandemic, and I hope that the sooner the vaccine is available, the better, not only for the health system, but for the society, for the economy, for all of us to start exiting this difficult situation.
Thank you very much, Honorable Minister. I'd like to thank all the panelists for this fruitful and insightful discussion. I stick to the optimistic parts of the discussion that hopefully the sooner the better we'll have the vaccine and then we'll have the recovery. So once again, thank you very much, and hopefully next year we'll be all together around the table discussing how we move on from here and how Greek economy has recovered, thankfully, after the end of the pandemic. Thank you very much.